Heard the phrase, it takes a village to raise a child. In South Carolina, it seems that village is being called on more and more often.
Kinship care is becoming more prevalent. That's when relatives step in to care for a child when parents can't meet the child's needs.
A new study is giving greater insight into how often this is happening. Shelley Garzone has the details.
We're hopeful that at Kinship Care, not only in South Carolina, but across the country, that, being placed with someone that they know, that they have bonds with, that they have a relationship with, can help maintain those networks of friends and school and family.
Conley Ann Ragley is the Chief External Affairs Officer at the South Carolina Department of Social Services. She says formal kinship is on the rise in the state.
We've seen growth in this. Just going back to 2019, licensed kinship caregivers in South Carolina were in single digits. And as of today, 27.2% of children and youth in foster care are in licensed kinship care placements through the agency.
Kinship is when a family member or family friend steps into the role of the parent in a child's life. DSS says there are formal and informal kinship placements.
Formal kinship care arrangements are licensed through the Department of Social Services as a licensed foster home, and they're compensated for their care.
Kin Carolina Intervention is a group based out of the University of North Carolina. Based on South Carolina's elevated numbers, the group is working to gather data as well as to support kinship caregivers raising children with disabilities or special health care needs in the Midlands.
There was a huge population in South Carolina in particular that was existing in this informal space where not only is their data not being captured because they're not part of a formal system, but they also are not receiving the formalized supports that, say, a foster parent might receive.
According to Grand Families, a national legal resource in support of grandparent-raised children, says nationally, for every child in formal care, there are 19 in informal care. In South Carolina, for every child in formal care, there are an estimated 308 children in informal care. Whether statewide or on the national level, the goal is to support families and meet them at their need. Shelley Garzone, News 19, WLTX.
In North Carolina, for every one child in formal care, there are 58 in informal care. That is compared to 308 in South Carolina.